So in 70% of the cases, the conventional procedure is effective and it's satisfactory and it's successful.
Yes.
But 30%, like you, it's 30% is a very big number.
Mm.
It is the same in embolization. Embolization makes an obstruction of the veins, totally the internal veins from upper part, and all the internal veins disappear, but the external vein, gubernacular vein, stays there. So 30% of the patients, the blood flow finds a new route from the gubernacular veins. And for laparoscopic surgery, every kind of surgery, this chance stays there.
Yes.
So testis delivery. In the literature, it says it is equal to deliver the testis or not. The results are equal. This is not true. This is not true. Even this is not the final solution. It's not enough just to deliver the testicle.
Yes.
When you deliver the testicle, you have to ligate the gubernacular vein and you have to occlude the escape route.
Okay.
This is the escape route of the blood.
Yes, so blood can flow
Yeah.
easily back and forth.
And it's very easy.
Okay.
You don't have to take out big segments in gubernacular, but external vein, it is usually twisting around the testicle like a radiator and very easy to remove because it is twisting alone. It doesn't have an artery beside. So it's very easy to remove it.
It's like pressure in the testicle, right? So it's like pressure in the
Yeah,
testicle.
it's making a heat,
Yes, yes.
like a heater, and this heat softens the testis, softens and makes pressure, increases the pressure inside the testis, and decreases sperm count. So the operation, I believe, will change in the near future because you are coming from one of the best centers of the world, and the other guy was coming from Florida, again one of the best centers of the world. I had patients from New York. They are operated in top centers, and the operation was done 100% perfect in the way it is defined in the literature and in the guidelines. It is advised to do in that way.
Yes.
My way is different. It's not in the guidelines. There is no research papers about it. It's not proven, but I have experience. I'm sorry, I am not the top scientific guy who have the residents, assistants around and make these research. I'm not. I am private practicing myself, fighting myself, and I can. My research, my publish is this.
I think in due time you will.
Thank
You
you.
will have the recognition you should.
So for these doctors, please understand this, and really there is a big recurrence. And the doctors, when you go to them and say, hey, still I can feel the veins. First, I was like that before. We say, okay, this will disappear in 3 months. If it doesn't disappear, because we talk to ourselves, the doctors talk to each other, and we said, what do you do when the veins did not disappear? They said, okay, they will not disappear, don't do anything.
Okay.
Sometimes in the recurrence surgeries, if you go for this recurrence to another surgeon who is doing conventional surgery, he will just open again. He will see the enlarged external vein in the upper part, in the inguinal region. Even if he delivers, he will see all the enlarged vein and ligate this part, leave it.
That's it.
Put it back again, and this vein will stay there again because it finds the new route from the gubernacular.
Yes, yes.
So I had many cases with 2 times recurrence. He has operated 2 times, nothing happened. So please, dear doctors, understand this, make some research, make some scientific papers, and I am also, of course, trying to do such researches, but the difficulty for me is people are coming to me for this operation, specifically for this, and I cannot say them, okay, I have to make a control group. One of you will be operated in this way, the other will be operated in the conventional way. Then we will compare the results. Yes. So please choose one of these, and okay, you choose the conventional one. Now I have to operate you in the conventional way. This will not work. Nobody who come to me from United States will accept that I will operate in the conventional way. Okay, so when you go to your doctor, what his comment? Did they say, okay, we have to reoperate, or what was the comments?
Well, After asking me to do, and I believe I did an MRI, then they said, oh, I think there may be a problem on the left side, so we may have to operate on the left side.
Yeah.
But I felt like the left side was fine.
Yeah, it was fine.
And I even went to another doctor like 6 months later, and he said, no, your left is fine, just the right side there's a recurrence.
Yeah.
So that's when I was like, no.
Yeah, they said recurrence, but the solution, did they recommended you the second operation?
They did. I just didn't
Okay.
find the right person that I can trust to do
Yeah.
the same.
Yeah, actually, the secondary operations is more difficult compared to first one. So the doctors are always reluctant to do the secondary cases. And to be honest, I can give a trick. So in the ultrasound, when you look with the ultrasound, this is testicle. If the recurrent veins are at the below of the testicle or around the testicle, these are external or gubernacular.
Okay.
But if they in the upper part, which is not your case, upper part of the testis, these are internal veins, and if they are only in the upper part, internal veins, the best recurrent operation is embolization.
Oh, wow. Yeah.
Embolization is have a very high chance to solve the problem in the internal veins.
Mhm.
It's easy. It's not an operation. They go from the blood vessel, they go and they come to the very ending of these veins.
Yes.
All the internal veins come together and unite, and they block this from that part. It's perfect.
Yes.
It's perfect for the internal veins. Only difference, if there are two main branches going to up to the main bloodstream, they may sometimes miss one of them.
Oh.
And half, I see such patients.
Yes.
Half of the internal veins are very well treated, died completely, half alive. So in these patients, there are two main branches of the. But it is, if they are careful enough, they will understand and occlude both of them.
Yes.
But this is perfect. Embolization is perfect for the internal veins, and before the operation, you can understand it with a ultrasonography. If the veins are under the testicle, no chance for internal veins.
Yes.
Internal veins come from the spermatic cord, enter from top of the testicle, and they are located here
Yes.
and in the inguinal area, upper area.
Yes.
But if they are twisting around, if you can feel the sac, worm-like sac in your testicle, these are external. So the other guy coming from Florida again, he had the external vein recurrence, and the internal part, when I travel to his spermatic cord, I see the metal clips. Everybody afraid of that. They are really good, but I don't use anymore. People have too much concern about it. Metal clips and ligations all were done very well, correctly. And the internal veins, they are very thin. They are not big, no problem. Still, I ligated them.
Yes.
But internal part was perfect, but external vein, huge. So, thank you for coming. Thank you for choosing us.
Thank you.
Do you
so much.
recommend us to others?
Of course, of course. I've been watching your videos for about a year now, and I thought you're probably the most experienced person in this field, so I'd recommend it to anybody that has the same condition.
Actually, this is true, because, I only operate nowadays varicocele and cystitis in women. Very rarely prostate operations, a resume procedure. In last year, I operated 36 prostate resume operations and 350 varicoceles. So, as you see in the office, there are many people coming from Turkey, coming from abroad for this. So we are specifically focused on this subject.
Yes.
If I was working in a hospital and dealing with all urology diseases, I can't do it. I can't do it because in private office, you can choose your patients. If somebody is calling for me from, for example, prostate cancer, I say, okay, I'm not expert of it. Please go to my colleague. He is focused on prostate cancer. He can operate you. So I choose. But if I was in a hospital, they will come. I will have to do all the operations. So a normal urology doctor operates 2 varicocele cases in a month.
Yes.
I operate 25, 30.
I know.
So thank you for choosing us. Thank you for coming.
I appreciate you.
Yeah, thank you.